My name is Graham. I'm 67 years old and I'm a retired commercial banker who used to work in London on a daily basis. I play the occasional round of golf, not very well. I enjoy gardening and I enjoy going to the theatre with my wife and also visiting various restaurants. About 2 years ago, I visited my local optician for a eye checkup, and I knew I had a cataract on my right eye, and I was prepared to be sent over to our local hospital for an operation. But what I wasn't prepared for was to find that I'd got very high pressure in my right eye. Although this was diagnosed quite quickly by the optician. In fact, he took the pressure 3 times because at 42 the eye pressure was the highest that he'd seen for a long, long time. He immediately referred me to Northampton General Hospital, and I was given a tablet which over 24 hours reduced the pressure, but not significantly. And I was then on a course of visits to Northampton General to have regular monitoring of the eye pressure, and sometime later it was reduced sufficiently to allow me to have a cataract operation. When I was diagnosed with the high pressure, it obviously came as a complete surprise to me because I'd had no pain in the eye whatsoever and no discomfort. Thinking back, I now recognise that there was the odd occasion where I'd fallen over, particularly when I was on holiday in Indochina on one occasion. But at that time I didn't put it down to the pressure in the eye. This is only something that I'm thinking may have been the cause of me falling over at that stage. I didn't really think too much about how it was going to affect my lifestyle, if at all. And in fact, in the early days it didn't. It was only watching television, again, seemed to have little effect because of the pressure in the eye. So again, I'll go back to say that if the optician hadn't diagnosed it, I wouldn't have been aware of the situation, which could have been a serious issue if I'd not had it remedied with the operation. It was recognised by the glaucoma specialist at Northampton that I needed an operation, and the most likely operation would be the implant of a bare-field tube into my eye. Unfortunately, that operation could not be carried out by anyone in Northampton Health Authority area, and even Mr. Jutley could not operate in Northampton. So the next stage was to be referred to Mr. Jutley.
It was an absolute pleasure to meet Mr. Blanchard when he was referred to me from Northampton, having been treated for glaucoma up there. The key thing for me was to elicit what the cause of his high pressure was. He was struggling with so many eye drops, and as a consequence, we needed to make a definitive management plan. The first thing we needed to do was to make sure that his pressure came down. Having a pressure in the 40s to 60s will ensure that your optic nerve gets damaged within months, and that will lead to irreversible blindness.
The first meeting with Mr. Jutley changed my attitude quite a lot. I found him to be so confident and so relaxed, and he treated the issue as being part of me rather than just my eye. So it was more than a clinical review. It was speaking to me as the patient and what did I think and how was it affecting me, etc., etc. And this level of confidence, say, made me very confident in my thinking of the way forward, and made me think quite easily that yes, I needed this operation, and yes, I was going to have the operation, because the alternative was that if I didn't, I would lose the sight in one eye eventually, and maybe sooner rather than later.
I got to know Mr. Blanchard and realised he was very well informed and he was very motivated as to surgical options. So, to try to demystify the absolute definitive treatment, which is tube surgery, I showed him a video of me doing this surgery.
To see the operation on a screen, it didn't relate to me as being an eye operation. It could have been anything really, almost a something from science fiction. And I watched it on that basis rather than thinking, well, this is what's going to happen to my eye. And it did give me some confidence. So on the day of the operation, I was taken down to the operating theatre and met with the anaesthetist down there. And I think I was away from the room for about an hour and a quarter before I returned, where the operation had been, after the operation had been successfully completed. I have to say that the operation was carried out brilliantly, no pain whatsoever. I thought I might feel a bit queasy, but I didn't. I was fine.
I always ensure that I have regular follow-ups with my patients after operating them. This ensures that not only can I pick up any things that need to be modified, but also to give patients confidence that things are going well and address any queries they have in a timely fashion. After
the operation, I had to cope with an eye patch for the first 24 hours to keep away any infection. But I was able to see out of the eye without any problem whatsoever. Again, there was no pain, but there hadn't been any pain before the operation, so that didn't really change. But overall, painless experience and continual monitoring by Mr. Jutley and his team.
I'm delighted that after such careful follow-up, we were able to elicit that the stitches were loosening as the tissue were healing, so we could take them out.
After the operation, my life quickly came back to normal, and I've got a final meeting in the not too distant future. I've played the odd round of golf again since having the operation, taken up the working in the garden, and the one thing I have noticed is that I haven't fallen over since I had the operation completed. So all back to normal, and long may that be the case.
I was delighted to see Mr. Blanchard last week, and impressively his pressure is down to 14, which represents an excellent effort from both my team and himself.
It was an experience to meet Mr. Jutley on the first occasion. I don't think I've ever come across anyone in his position who has been so relaxed but oozed so much confidence. As I say, he treated me as a patient, as an entity rather than as someone who'd got an eye problem. So he kept me fully informed all the way through. His entire team were very, very professional. Now, I would thoroughly recommend Mr. Jutley to anyone who has glaucoma or needs an operation, and I can't speak too highly of him.